Hello, dear friends. Welcome in Homeopathic Canada live session, and today is the fourth day of December Homeopathic Conversation series. So, today we will discuss uh, Nosodes, and I invited today one of the homeopath from Canada, Dr. Jessica Yakub, and she will be with us very soon. And after that, we will. Today we will discuss Pertussinum Nosodes, and during this conversation, we will touch all the key points of this Nosodes. We will discuss few cases. I will show you some repertory points of view too, so we can easily understand this wonderful drug. One thing more in during this series, because we will discuss whole cases, conversation, how to select the dose, how many times we have to prescribe that dose. Potency we will discuss in coming days, but today we will focus on pertussinum, and we will see few cases, and I have few cases of our stalwarts too. So I will discuss after that once Dr. Jessica finishes whole conversations. So I would like to welcome Dr. Jessica in this conversations, and thank you so much for your time with us, because we are doing a noble job to describe what homeopathy can do in medical fields. Over to you.
For sure. Thanks for connecting again today. Our infamous connections are always great. Okay, so today you invited me to talk a little bit about Pertussin Nosode.
Yeah.
And actually, I had two cases recently, a couple, I think almost a month or two ago, where I actually utilized this nosode for the very first time. So I love nosodes. I always feel like they should be used intentionally, very minimally, and only when the case calls for them, right? So I'm not that type of person who's just going to throw a nosode at something because you have pertussis, so therefore use pertussin nosode. That's essentially isopathy, right? I'm always going to try to go for a well-selected remedy first that matches the totality of the symptoms, and then, utilize the nosodes accordingly. But I was grateful that I did because it really turned around the case and showed me the power of this nosode. So, just did you want me to talk a little bit about like whooping cough in general, or do you want me to just
No,
go
no,
straight
no.
to a
No
case?
need. Just we were focusing on pathology. No, we are not focusing on pathology. Just
Okay.
focusing on the drug.
Okay. So essentially, I had two cases of whooping cough, and they weren't necessarily confirmed by the medical doctor. Like there was not a complete diagnostic, but essentially the case itself, the cough had come up, and whooping cough has a very distinct coughing sound. Okay, so many times if you hear this particular cough, which is very spasmodic in nature and will go on and on and on and on until the point of either gagging or vomiting up kind of like the mucus. And then followed by that, you'll shortly have like a wheezing noise that kind of sounds like a whoop at the end, where it will go like that. You can kind of be certain or have in your mind a differential for whooping cough. So the thing with whooping cough, though, is in these cases, many times the first week or so will just present like a normal cold. So as homeopaths, we don't necessarily have much to prescribe on at that point, because what is typical in a cold is typical in a cold for everybody. Maybe some nasal discharge, maybe a little bit of lack of appetite, and maybe a little bit of lack of thirst at that point, but maybe you're still doing well and all you have are these cold symptoms, right? Just mucus and a little bit of like under the weather. So in those instances, I don't generally prescribe because I like to wait for the disease picture to develop so that I can utilize the remedy that suits that picture perfectly, right? I feel like if you just start throwing remedies, it's kind of acting haphazardly. That's where homeopathy I find will fail. So at that point, I just said, they went to the patients had gone to the doctor. Doctor said, yeah, it's just cold and flu. I said, well, just see what happens, right? And then sure enough, over the course of the following week, a kind of more of a spasmodic cough came around, um, where they were kind of like gagging. Um, but the whooping sound was still not there. It was just like cough, cough a little bit, and then it sounded like that. Like they were like kind of gagging at the end. So in my mind, I'm starting to think, okay, this possibly going to develop into, whooping cough? Is this a case of RSV? RSV can look kind of similar. So I'm starting to differentiate, right? In terms of pathology. But at that time, all I had was a distinct characteristic of, a cough that was kind of leading to gagging. And so I started with Ipecac at that point, right? And that had brought about some relief. But then the cough had, and at that point I had said too, I think this could be either RSV, but I'm not going to be surprised if this develops into like whooping cough. So pay attention if this comes at the end. And of course, sure enough, the day after I said this, I get a voice recording of the cough and I heard it. But now I had more distinct symptoms with an after midnight aggravation. Okay. So now this cough was coming on worse after midnight, starting around 12:30 or so, and worse as soon as the head went on the pillow, lying down at nighttime. And during the day, the gagging cough wasn't as bad. So now I have a nighttime modality, worse lying down, head on the pillow, and then also a midnight time modality as well. And at this point, I had heard a very clear, distinctive spasmodic cough with a whoop at the end, or a whoop at the end. And all of that had led me to Drosera. And then when we started Drosera, the symptoms were getting much better very quickly. And like both mom and grandma were very happy with the progress and saying, this remedy is working. We need to stick with this remedy. Okay. So progressively getting better, but the progression was daily getting better, but it was still kind of lingering. And I had done some studies on Pertussin and read some notes about whooping cough by Dorothy Shepherd, the homeopath. And she had basically said, if you are treating whooping cough homeopathically and successfully, it'll take 1 week to get rid of the whoop and vomiting, and then the second week to get rid of the residual cough. And with whooping cough, usually there's that 100-day lingering because the bacteria ruins the cilia in the respiratory tract. And so then that's what leads to this nagging long cough for a very, very long time. But with homeopathy, in all these historical cases, the cough had basically dissipated in less than 2 weeks. It didn't linger for 90 to 100 days. So this was a challenge for myself now as a homeopath. Can I put to truth what, the previous homeopaths have said in their cases? And so I decided to utilize, based on a little bit depth and study, the Pertussin Nosode in a 30C in a single dose. And literally, it was the case, even though it was progressing so beautifully with Drosera, we could have stuck the course. I do feel it was probably, going to continue so beautifully. But as soon as we used the Pertussin Nosode, it was like, boom. Mama's like, this is amazing. The cough is not there overnight. Like, so much better. Everything is like great. And literally shortly after, like a day or two after that, all symptoms were kind of abated. And so then the second kiddo kind of had the same symptoms develop over time. And so I felt comfortable dealing with sorry, I felt comfortable treating what I was dealing with because the children were faring well. The doctors were involved before. We're always watching for red flags, but I'm comfortable. I'm also taking into consideration the age of the children. They're not under the age of 6 months where it's more serious or life threatening. 2.5, 3 years old, I feel a little more comfortable. And I kind of just stuck with Drosera for the other child, but mom was kind of pushing me. Can we please use the no so now? Like it works so beautifully for the other child, but I wanted to just see and kind of take one case and compare it to the other. So I just stuck with Drosera, and of course, we were making progress, but it was taking a little bit longer than the first case. So then I said, okay, now I will add in Pertussin because now I will see. And then again, added in Pertussin and boom, that was it. That was it. It was beautiful. It was like magic. I was like, okay. And, the 100-day cough was not a 100-day cough for them. By 3 weeks from the time of the cold and all that, they were much better. And cough was, I think, maybe once there in a day for like a week after or something. But that nagging, vomiting, gagging cough, no irritation at nighttime was an issue. And so not only did I become a fan of homeopathy for this, but the two remedies which have been proven beneficial in historical cases, both Drosera, which Hahnemann says, Drosera and 30C potency, he says give one dose, wait and watch. And then uh, following with more recent cases in more modern times with the Pertussin Nosode, where literally it turned the curve in the case almost overnight, was exactly what had happened in my cases. And so I just wanted to share that a little bit. Again, as homeopaths, we're never treating conditions, I always have to say. But I mean, at the same time, we have to be aware of pathology of what we're dealing with. So that's all I wanted to share there, I guess.
So this is very, very wonderful. And I will give you a one differential diagnosis for Pertussin. So as you say, is in at 12 o'clock when he touched the pillow
Mhm.
and the cough started. So everyone who are just watching this video, two remedies always remember in this condition, but the modalities of these two remedies are different. Why Pertussin here? Because when he touched the pillow, cough started. But if the person having similar cough and he says, Doctor, whenever I sit like this, now my head is up, he feels relief. The remedy is Hypersulf.
Mm,
And if the person has aggravation while laying down and he has to sit up and he put the head on the arm, then he feel relief. Then the remedy is arsenic album, especially when it is the midnight time.
mhm.
Pertussin having a wonderful effects, especially if the person having a whooping cough or the history of whooping cough or any family member having a whooping cough at that time.
Yeah, that's true.
So, in during this process, we can use Pertussin.
Hmm.
So, I have almost 6, 7 cases. This is all by our stalwarts. The first case is TJM Colette, Dr. Julian. He was living in Dr. Julian. Dr. Julian, he described very wonderful descriptions of Pertussin. So we have to go one by one. So the first, he give a mental state of this patient, and he said the person is exhausted mentally. The person who having a whooping cough, he is exhausted mentally because this is a fed up. This because this cough is so long that, as you say, is a 100-day cough. so long. And the person who having this trouble, they have lots of problem because cough cause sometimes bleeding from the mouth. Cough cause sometimes pain in the chest. Cough cause sometimes pain in the abdomen because the whole system is stretched because of that cough. Exhausted mentally. The second is easily intoxicated. Third one, desire to sleep or lie down because both these conditions aggravate the cough. He wants to sleep, he wants to lie, but because of this cough, he is not able to. And fourth thing is having a very difficulty in concentration. He is not able to concentrate. So I would like to show you first the whooping cough, how it look like.
Sure, that's good.
Hope so you guys can hear this thing, or the voice is very low.
It's low, but it's audible.
Okay, I will show you one more video. This holiday season, let's get ready for a yellow Christmas.
Whooping cough. It's a bacterial infection that's risen to epidemic levels in some parts of the U.S. In adults, the symptoms can be mild, but if the infection is spread to a baby, shy. 21-month-old Pedro Escueda's symptoms started out like those of a typical cold.
He had a runny nose and started having a little cough.
But over the next 4 to 5 days, Pedro's mom, Chelsea, says the cough got much worse.
It was nothing I've ever heard before. He was coughing and doing the whoop.
So this is the whoop.
And he couldn't catch his
This
breath
is the
when they
whoop. So whooping cough. This is the whoop. This is the diagnosis of this disease. So this is a 100-day cough, and it is worse. More the person cough, more he is aggravated. More he cough, more he aggravated. Emotions, effort, and the rest. And one objective symptom you will notice in this case, and that is touch, impelled to touch. He involuntarily touch the throat. Involuntarily touch. Whenever he sit, he just involuntarily touch the throat. So what? Eating and cold air both aggravate these conditions. From taking cold, aggravations. From sighting at the end of cuff. What is sighting? This is sighting at the end of cuff because he just want to breathe more deeply in these cases. And in few cases, vomiting on coughing. That's why this person having a gagging. And the few cases there is a epistaxis during cough
Mm.
because of the cough, because of the force, the vessels of the nose ruptured and the bleeding come out.
Mm-hmm.
Second important thing, this cough is always convulsive and continuous cough. If you see in cactus cacti,
Mm-hmm.
this is a stain gun cough, like the bullets coming from the stain gun. This is the same, like this spasmodic cough.
Mm-hmm.
Spasm, so much spasms, and this is paroxysmal.
Mm-hmm.
Two things, paroxysm, and one more thing is remittent. Uh, uh, Paroxysms when the cough did not stop, but it continuously going on. One paroxysm is attached with the another one. Whooping type of cough, as you see in the video. Third, stringy. stringy pain, stringy mucus coming from the when he gag, stringy
Hmm.
come out.
Yeah.
And the fourth important thing in this cough is stinging pain. Like something is the pin is touch the flesh of the skin. Very, very stingy, very stinging pain. Just with the cough. Whenever he cough, he feel that stinging pain. And the discharges are always like kali by chrome. Very viscid consistency, spitting mucus and expectoration that stick to everything. Everything. These are the characteristic of this remedy. Let me share these cases. So, Dr. Follett, he see this case in September 1879, and he described wonderfully. That time there is an epidemic of that whooping cough among the children. So the directress of the school brought me some of the children suffering from whooping cough. So that time he took the secretion of one of the girl and made a 6 dilution in alcohol. I advise to give 5 drops of this remedy in 2 tablespoonful of water to give in morning and for 4 or 5 weeks. So at that time, isopathy that is given by Dr. Herring, isopathy remedy because he made so lots of no source. So isopathy, they are making remedy from the discharges, the disease discharges of the people. So that time Dr. Colette make this no source from the secretion of the girl
Hmm.
and give for 4 to 5 weeks even when the children have no fit of cough. If there is no cough, you should give in to that person. And this because of the tenacity of the disease and it's easily relapse because of that epidemic. The fits of the cough diminished rapidly during the day, although the fits were more frequent at night. It means these coughs always aggravation at night.
Hmm.
Aggravation at night, daytimes they are good.
Hmm.
But after 8 days, in many children, there is a great amelioration, although some of them had a cough from time to time, and after 15 days, almost all children become almost normal. Normal. Nevertheless, the use of the medicine was continued 5 drops every week for 2 to 3 weeks more in order to be assured to complete the cure as the disease often can reborn out of the ashes.
No, it's interesting. Again, 15 days. All the historical cases, 2 weeks.
2 weeks
And in my case, almost, it's amazing. It's amazing, yeah.
in 2 weeks.
Hmm.
Then Dr. Clark, he recorded few cases, and I will describe all these things. So, a cases from US has been coughing for 14 days. The person is 20-year of old and having a whooping from 14 days. When I was sent for to see her at their home in October 1905, the patient was a victim of infantile paralysis. So I just want to mention one more thing here. Sometimes people using lots of antipathy drugs and they suppress the cough. So here, paralysis can happen after suppression of this drug. And second important thing, Dr. Julian recorded, that is type 2 diabetes with onset after a long term cough or whooping cough itself. If there is a history of whooping cough, it can happen that person suffer from type 2 diabetes. That's why suppression, we should inquiry the history. And during this history, we will find if this kind of situation and the presenting disease, we can correlate them and we can just prescribe them remedy according to the situation. So that person having a infantile paralysis and was very easily upset in her nerves. It means these people, the pertussin disposition is very delicate, very delicate. If you guys have pen and paper, just write it down. Pertussin people are very delicate. And how we can judge delicate? Mothers always tell you, doctor, I don't know how this person can get suffer from this cold. Even us, I just open the outdoor, a small wind come inside, and he gets sick. The patient who are easily sick, easily, uh, even the person doesn't know how they can sick, they get this cold, how he is protecting themselves very well, but they will get indulge in these sickness. These people are very delicate. You can call them delicate personalities, and Petusian is a delicate personality. And since that time, the family always got into a panic. So when the cough started with her, because it was apt to keep on for a long time, because he is already suffering from this cough from last 14 days. On the present occasion, the whole family were detained in London by it, and as they dare not risk traveling, though they very much wish to continue their journey. The patient had successfully vaccinated, but the doctor tried to vaccinate her several times before they could get it to take. It means when this person having this problem, he is already taking so many vaccinations. He got 8 times vaccinated. So she was subjected to a bad sick headache, which she used to get at a monthly period. It means that person after vaccination, he has repeated headache. She was also subject to heavy cold in the head. Second, easily getting cold, feet cold and dry. When she goes to bed, on first laying down, she cough. Immediately when she lie down, she start coughing. And when once she get over this, she sleep well for a time. Once this episode gone, she sleep. The cough is dry and is brought on by motion. Whenever there is a motion, the cough started. I may say that the family were allopaths for the most part, and but they were heard about me and from the nurse whom they met in Paris. Their one sheet anchor in their condition was naphthalene, nepenthe. This drug they are taking that time, nepenthe, given in 1 or 2 drop doses, and this was the only thing that sufficed to keep the patient quiet till she could get sleep. They use this drug to relieve the patients. So in this condition, we have few modalities. First, once the person lie down, he get worse. Second, whenever he gets some slight motion, he get worst. And after taking medicine, she can sleep. So there was nothing very characteristic in this cough that I could discover. So he gave stinin met third potency to the patients. On October 4, there is no changes. No changes, but Nepenthes is given to the patients. Now, I had to go more deeply in the case. Once he got one more symptom, that is pricking in the roof of the mouth on laying down. So pricking some the roof of the mouth. This is the roof. This is it means hard palate. Whenever he cough, there is a pricking sensation. Pricking means some if some sharp things is going into the flesh. The sensation produced by this condition is called pricking. So pricking in the roof of the mouth on laying down. And I was told when I first saw the patient that she had never had whooping cough before. She doesn't have whooping cough before. But when I come to the cross examination, I found that when she had the first attack of this cough 10 years before, the question of whether or not it was whooping cough was confessed, and all the pros and cons having been duly considered, and it was decided in the negative. She must have had whooping cough many times. If it was, the mother remarked. So at any rate, I thought it was nearly enough to make a like as she had strangling fits. Strangling means the person is not able to breathe. During cough, the person is not able to breathe with the cough, and she would never get her breathe back. This is the feeling of the patient. Whenever he coughs, he feels that she is not able to breathe again. And this is the sensation. So, two characteristic symptoms he got after a second visit. One, there is a pricking sensation in the roof of the palate when she laying down, and the second whenever she cough, this is strangulating cough, and she feel that she will never get her breathe again. So during these, according to these two symptoms, he prescribed pertussin to that person. So on next day, cough is absolutely better, not so constant.
Hmm.
Settling fits in bed not so bad. Less pricking in roof of the mouth. Very little expectoration, but much nasal discharge, that which is thick. Then he repeat the dose. The patient was so much better that the parents thought they need not trouble me again. Then 8th of October, I receive a polite note from that lady. The patient's father, my daughter was improved so much since she has taken the second remedy, and they decided to leave the that country to go for the destination. So this was the case. So during this case, what we got very characteristic symptoms of the pertussin given by Dr. Clark.
Hmm.
First modality, laying down, sudden slight lay down aggravate the patients. Second, motion aggravate the patients. And third thing, the pricking sensation in the mouth on laying down. And the third one, whenever the patient cough, he feel that she is not able to breathe again because that much spasmodic cough the patient has. So this is the wonderful case and very characteristic symptoms of the patient. So this is the first case. Second case, this is the case of father of that doctor.
Hmm.
Daughter. So he is 65-year-old and having a cardiac asthma, which come on 18 months before after a treatment of her daughter. So he had good general health, except that he was very gouty. His mother and his maternal uncle had both died with the heart attack. His father died in 60 with paralysis. He had been twice badly wounded in the American War, and he was suffered from delicate throat since he was 4 year old. Mention, just note it down, delicate throat. The statement, the personality disposition is delicate. Delicate throat means the person who easily suffer from the change of diet, who easily suffer from the change of drink. They easily stirred by the change of weather. That's why this is called delicate. That's why. So when he was 4 year old, his throat was very delicate. His throat, I found, was gouty looking, and he was trouble with tickling in it, which caused the tickling in the throat, and the cough was in paroxysm. Paroxysm. This is the type of cough in the patients. So there was some wheezing in the chest and bronchial rays at the base of the lung. The heart was enlarged and there was free nasal discharges. The tongue was fairly clean and the appetite was good. In breakfast and lunch, the bowels are regular, but for 20 years, he had been liable to suffer from chronic diarrhea. Before this condition, the person having a chronic diarrhea, and he had been 8 times vaccinated, the last being at the age of 40. It means so the person having a chronic diarrhea and he took some medications. When that the diarrhea solved out, and after that he got see this bronchial situations. The cough and the asthma were the trouble. In consequences of asthma, he has an exile from his native land. He positively could not exist in America. Whilst I was examining him, it fortunately happened that a fit of coughing come on while Dr. Clark, when he examined, he start coughing. And I was thus unable to observe it. During the paroxysm, the appearance of the patient was exactly look like that a person in a fit of whooping cough, but there was no whoop, no whoop. There is no whoop, but the character of the cough is very similar to whooping cough. So he decided to give Pertussin to that patient. 3 days later, he called again, and a grateful patient, I found him. The cough was almost better. The cold had all gone from the nose. He slept well on night, and last 2 nights he is disturbed by the asthma. So for asthma, he given natrum sulf 30 every 3 hours. Now there is on next 3 days there is no cough, no phlegm, no asthmatic attack. Everything is okay for him. So this is the second case where Dr. Clark found out there is a characteristic cough, very characteristic cough. So these are few cases because there are lots of cases. We need lots of time to find out. So we discuss these two cases, and these two cases will give us a characteristic indications of pertussin. So, in definitely in second session we will discuss the remaining 6 or 7 cases. But in these 2 cases, we learn that the disposition. If we see organon of medicine, Dr. Hahnemann described as disposition decide. Sometimes disposition give us a clue what we have to prescribe to the patients. So pertussin patient is very delicate, very delicate, and easily when your well selected remedy is not able to give a wonderful cure or relieve the patients, then we can think of no sorts. And the type of cough, the characteristic of cough give us a wonderful clue to prescribe this remedy. And Dr. Clark gave a wonderful descriptions of the case, and that one, the pricking sensation on the top of the mouth while laying down, aggravation when laying down, aggravation by motions, and the sensation of that patient is as if he start coughing, he is or she is not able to breathe. So this is all about pertussin. And one thing more I just want to mention here, uh, for the children's. If we prescribe this remedy as a constitutional basis, if the person having a history of or the mother having a history of this disease, and uh, she use antipathic, and they suppress this drug during this process, and after that she deliver the kid, and the kid having sudden childishness, the kid developmentally, there is a developmental issues in kids, suddenly unable to work, arrested development. This is one of the most important part of pertussin. Arrested development, one, sudden childishness, retreat, retiring from work, collectors, he collects so many things, avoiding connections, and suddenly unable to work. These are few things if the person having developmental arrest, and he always desire to touch, he always desire to cling, and at the same times always aversion to touch. And if you see the repertory, I will show you on repertory.
I have a chronic case now that I'm thinking of this remedy for.
So first symptom, only single remedy, larynx and trachea, voice broken, talking loudly, aggravation, single remedy, pertussin.
Mhm.
Hacking cough. Hacking means once the coryza start, after person having cough with the mucus. Second, jerking of the head forward and knees upward with. When he cough, the head jerk upward, and the same times knees goes up. This is just a observational symptom, and only two remedies are there. First is pertussin, second is phosphorus. Then cough spasmodic. Spasmodic cough, especially the people suffer from bronchitis. If the person having tuberculosis and having a very similar spasmodic cough, we can think about similar remedy, because in this rubric only a pertussin is there. Then larynx and trachea inflammations, especially larynx, and that cough will be spasmodic. Asthmatic, respiration asthmatic. During cough aggravation, whenever he cough, he is feeling that he is not able to breathe again. Stomach, vomiting after cough, mouth, itching, palate, night, laying down. If there is a itching or is there is a pricking sensation. Itching palate night, expression, bewildered. Mind, touching, impelled to just single remedy. Just one remedy is there, pertussinum. And tormenting others because of her condition, he is disturbing a lot to others. He's disturbing a lot to others. So this is pertussinum. So if you guys have any question, you can ask. Otherwise, we will see you tomorrow with the new conversation because tomorrow we will discuss Bonninghausen repertory and we will discuss few cases too. I invited Dr. Kapil Sharma from India. He is a master of Bonninghausen repertory. So we will discuss at the same times, almost 10:30 Toronto time tomorrow. So we will discuss from Bonninghausen repertory. See you guys. And thank you, Dr. Jessica. Thank you.
See you. Thank you.